Here's the first video in a series looking at points that can help with the symptoms of the COVID virus. Now, please don't think that I'm trying to say that I can stop this virus in any way. But one thing that acupressure and acupuncture is really good for is definitely reducing the symptoms of any cough, colds, flus, viruses like that. And the COVID virus is no different. There's been a lot of research done over in China, and I'm taking these points particularly from those researchers. So they have outlined which points will be useful and what for. And they are no different to the points that I would use in clinic for people who have got a normal cough and cold. And many people have found them very, very effective. Acupressure can be a really great way to actually stimulate these points. And it's something obviously that you can do yourself, so it's you taking control and finding a treatment for this particular nasty virus. So the first one I'm going to introduce you to is a point called Pericardium 6. So the pericardium is the protector of the heart. It lies within the chest area, obviously, and it controls how the chest is bound. So one of the major symptoms with this virus is breathlessness, difficulty in breathing. So if there's tightness in here, it's going to cause panic in the whole body as well. So Pericardium 6 is a very popular point for most acupuncturists because it's so powerful at calming the mind, bringing the person back into themselves and stopping them panic. So as you can imagine, it's a really useful tool for both reducing the breathlessness and also calming the mind. So the point, it's what we call tu sun. So a sun in Chinese medicine is a type of measurement, and the way to know what your tu sun is actually by using your finger. So this here is tu sun, and it's the same for everybody. So if you're going to be doing it on somebody else, you're going to be pressing this point on someone else, you need to know their measurement. So you then guide like this and then pop it on. So this one's on the wrist. I'm going to find this difficult to do on the video, but you're going to be going, it's in the middle of the wrist, coming up through here. It's in between two tendons, and then you're going to go like this. So what you want to do is just pop the crease of the knuckle onto the crease of the wrist, and you'll find there's a nice little depression between two quite tight band feeling points, and they're the tendons, are the quite tight bands. Sometimes some people have only got one tendon, and then just look for the middle of the wrist, and you want to be pressing. So mine's around here. Because we're just using acupressure on this point and our fingers are quite big, we don't have to be hugely accurate. So what you'll find is a point that when you press, actually your wrist just relaxes a little bit. You can see how mine wants to flop over as I press on it. And acupressure wants to be a firm press. It doesn't want to be jabbing your nails in, so it wants to be the pad of your finger, and you want to be doing a nice press, and either press and hold, or you can release and then repress. What you might find is if you press for too long, that the hands start feeling a bit funny, and that'll be just because you're pressing on some nerves and some tendons, and also you've got some quite major blood vessels in there, but you won't cause any damage, providing you are only doing just a firm but tender press, gentle press. Now, a good way to do acupressure is to do a little bit of counting in your head. So you're doing some nice deep breathing. So once you've found the point, perhaps you could move on to doing it with your thumb. So like this. And you want to be doing some nice deep breathing. So take a nice deep breath in and press. And then deep breathing out. And you can release. And keep doing that. If you've got a lot of breathlessness or your anxiety is just very high, because this point can also be great for just general anxiety as well. So you can be pressing this point, sat there perhaps, you know, thinking about kind of how to calm yourself down. So nice thought patterns would be for any general anxiety, you could be nice deep breath in, breathing in nice clean air, breathing out old stagnant air, and then continue to do that for as long as you need to. Really, what you may find is that once you've been doing it for a little while, everything just starts to calm down. If it doesn't work straight away, it's always worth coming back to it half an hour later. These points are all just a guide. Some points will work better than others, and that's because of your particular presentations, and that's why acupuncture is a very prescriptive treatment plan, and why if you've ever had treatment with myself, you'll know that I ask lots of questions about signs, symptoms, and your general health. And that's so I can understand you better and choose the points better. So if some points do work, but some points don't work, then that's fine. Just stick with the points that do work, and I'll be bringing out several different ones for both body points and ear points as well, because pressing the ear can be very useful. Now, if you bought a toolkit, this is a really nice one to use a magnet on. And the people who have bought a toolkit will know what that looks like. But what you would do is just clean the site off with a swab and then place a magnet over the top, and that can be kept there. If you've no magnets in your pack left over, you can pop a seed, and you can even pop a little tiny needle there as well. The little tiny needles, just be careful. You want to be avoiding the actual the blood vessels, so place that away from the blood vessel itself, and if you're lucky like myself, you'll be able to see your blood vessel. If not, then just stick with the seeds or the magnets. Don't use the needles there. Okay, if you've got any questions about location of this point, or if you need any further clarification of how to use the tools, please do get in touch. Don't use something without knowing about it properly.